Good evening, everyone. My name is Natasha Motongo. I am one of the mid-level providers at Austin Urology Institute. And it is my pleasure this evening to be talking to you guys today about men's health. And it's in celebration of both November, which is National Men's Health Awareness Month, but also today happens to be International Men's Day. So we're kind of doing it's kind of a combo celebration, if you will, for men across the board. And so I'm super excited about that. So why are we here today? Well, the goal of today's webinar is really, again, to spread awareness on men's health. And there is something called Movember, which is an actual global movement that encourages people to sort of advocate for men's health. And that is why they call it Movember. Actually, um, it is Movember it's what they call a portmanteau mix of November and mustache. And so the point of this month is to have men shave at the beginning of the month and then grow out a mustache. So they put together November and mustache and they got Movember. So it is a global movement. There's more to it than just the mustaches. It was actually designed to advocate specifically for prostate and testicular health, as well as mental health and suicide prevention. So it's a great cause. Movember is kind of the highlight of it, but it's something that happens all year long. So I'm very happy to sort of be championing for all of the men and kind of giving a little bit of some education tonight, hopefully helping men or women encourage their family members to take charge of their health and learn all about different men health topics. So I will start with some uh, statistics in regards to men's health. It's always good to get some perspective, right? We kind of hear the different things being said about men's health, but what are some of the highlights? Well, men die about 5 years earlier on average than women, and they are 70% more likely to avoid doctor's visits. So that is a very, very high percentage, right? So you can see why things like Movember has come about so that we can really help to advocate for men's health and educate about the different topics and things that, men need to know about their health. Also, 1 in 7 men are diagnosed with prostate cancer. So tonight I will be speaking on prostate cancer, among other things, but we'll talk more about that on a different slide. Um, then mental health impacts. So men are having higher suicide rates than women. And so we'll talk a little bit about mental health as well. So the here I have are the pillars of men's health. So this is kind of like a flash slide on what's to come, right? So on the top here we have prostate health. So I'll be going over prostate screenings, symptoms of enlarged prostate, prostate cancer. We'll talk about hormonal health, so optimization of testosterone, sexual health like erectile dysfunction. I do have more in-depth webinars for both hormonal health and sexual health. So if you are watching this as a recorded version on YouTube, you can click the links below. If you are live, you could always go to our YouTube page and check those out. Tonight, I will be kind of highlighting some things in regards to those topics, but there is other videos for more details. Metabolic health, right? So what does it look like for men? What's important to lower your cardiovascular risk? Importance of talking about sleep, diet, exercise, all the things that we know we need to keep up with, but we don't always keep up with, and how that can affect your health. Testicular health is another one. Not a lot of people are talking about testicular health. And, we want to, I'll introduce a little bit about what that means and how to do monthly self exams, because that's super important. And what kind of signs and things to be looking out for. And then lastly, mental health, and breaking the stigma. Oftentimes, mental health is another dismissed topic among the men community, and we want to be able to talk more about it and recognize, when things need to be done in terms of symptoms and things of that nature. So, lots to come ahead. So, prostate health. With prostate health, um, it's starting the conversation early. Screening really does save lives. And so, 25% of men said that they've never discussed a prostate cancer with their provider. So, this is not always a man's fault thing either. So, anybody on the call feeling a little guilty about it, don't. This is also sort of an internal provider health issue as well. And so that's why we have these initiatives like Movember, where not only are we educating patients and family members, but we're also educating providers in the importance of speaking up and talking about these things, screening when it's important. Specifically for prostate cancer, screening starts with moderate risk at about the age of 50. Moderate risk meaning you don't have any significant family history, you don't have any urinary related symptoms that might be concerning, things of that nature. Now, if you do have a significant family history, it's important to get screened a little bit earlier. And again, that's part of the conversations that you'll have with your provider. Um, 42% of men were not familiar with the warning signs of prostate cancer. So we'll talk about that here in just a second. 68% of men know someone who has prostate cancer. So that's at least where some of the conversations are happening, right? Is that someone knows someone who's had it, and what they've done to fix it and things of that nature. But it's super important to kind of keep those conversations going. So what is the function of the prostate? That word prostate gets thrown around a lot. Oftentimes people are like, or men are like, yes, I know I have a prostate, but what does it really do, right? Does anybody know, what the prostate function is? Well, it's a gland that makes fluid that carries sperm. So it's very important in relation to reproduction. It's about the size of a walnut. It sits just below the bladder, and like I said, its main job is really related to reproduction. But also, as you can see in this photo here, a normal prostate. This is the prostate here. This is the bladder here. You have the urethra, which is the passage of the channel which urine flows out of the body from, and you have clear passage here. So normal prostate, nothing really going on. Again, size of a walnut. But for some men, the prostate size can get or inevitably, I would say, the prostate can get enlarged. And oftentimes it can get as enlarged as this. So if you can see the difference here, that passageway, or what we call like a straw through a donut, has been impacted by the size of the prostate. So no longer good availability of urine to flow out, right? So these are men who have symptoms of weak stream. They're straining. They don't feel like they're emptying their bladder completely, because it feels like you're peeing through a bent water hose, right? I mean, it's a struggle, and you can see here in this photo, the prostate has even protruded into the bladder pretty significantly. So these are things that as we do screenings in the office, we talk about what all of those different things mean. But again, normal prostate, enlarged prostate, and it is involved in reproduction, but it can later in life it can become a problem if it gets too enlarged. So the biggest thing, again, screening. And what does that mean by screening, right? We're looking at what's called a PSA, which is a prostate specific antigen. This PSA is a protein that's released into the blood stream at low levels. And so when we check your blood, it's a blood test. When we check your blood, we are looking for these proteins. And oftentimes we want that number to be below 4. Okay. If it's above 4, that might indicate that something is going on with the prostate. And so, the PSA is almost like a smoke alarm. if it goes off, it doesn't always mean that there's a fire, but it tells us that we need to check things out, right? So, if the PSA is elevated above 4, then we are taking you down a pathway of oftentimes, checking out, what are you having, any urinary issues? Do you have a significant family history? And what does that look like, right? And then repeating, oftentimes, depending on the scenario, we're repeating the PSA and we're including something called a free PSA. So the total PSA is what we want to be below 4. And a free PSA is a number that gives us the probability of the total PSA being above, being uh, related to potentially a malignancy or a cancer. So we repeat that PSA in 4 weeks, and then we give you some information on what to do prior. So what I mean by that is, oftentimes, again, if the PSA is above 4, it doesn't always mean cancer, but it is a screening for cancer. It can be prostatitis. So prostatitis is just inflammation of this prostate due to bacteria. So sometimes, the bladder and the prostate are very close to each other, and sometimes if you have a bladder infection, or you can have bacteria that kind of infiltrates into the prostate and cause a prostatitis. And prostatitis is treated with antibiotics. And so, oftentimes we see the PSA gets elevated because those proteins that are released into the bloodstream are now released at a higher rate because of that infection, right? At And so we treat it with antibiotics. We repeat the PSA, make sure it's come back down. Okay. And then the third reason why, it might be elevated could be falsely elevated. And what I mean by that is, what you may have had sexual intercourse either the day of or the night before. We have patients who are bike riders, and riding a bike could falsely elevate it because you're putting pressure on that prostate, which is going to release those proteins a little bit more. So if that happens within like 48 hours of a test, then that could be, a temporary sort of false elevation of your PSA. So in 4 weeks, we're repeating it and we're making sure that you refrain from those things within that time period. Um, if at that time we repeat it and things are still elevated, there's a conversation to be had. And so it's, do we continue to monitor this level depending on what that level is? Or are we now proceeding with what's called a prostate MRI, which is imaging of the prostate, that gives us another piece of information at that time? If that, then that's ranked in different categories, and we kind of go through that. And if it's significant enough, then the ultimate confirmation or diagnosis of prostate cancer actually comes from a prostate biopsy. So that is kind of the end of the pathway for that. Now, going back to the time where you come in and your PSA is elevated, we're also doing a digital rectal exam. Yes, I know. Not a lot of people like to hear that. Digital rectal exam is a digit into the back of your rectum to assess the prostate. We're looking for hardness. We're looking for nodules. It's just another piece of significant information for us as a provider, to put along with the PSA, right? So we don't just want to rely on the blood test, but we want to get in there and really check for ourselves, do a physical exam. It's just proper. It's good protocol to do that, and assess and make sure that we're not feeling any abnormalities from a physical exam standpoint. Um, so if you come in and we're screening you for PSA and the PSA is normal, but you're having some urinary symptoms, then we take you along another pathway, and that pathway typically is what we call BPH, or benign prostatic hyperplasia, which is just another fancy name for enlarged prostate. Okay, so there's early detection matters in all of this. So if you're having urinary symptoms like weak stream, frequency, urgency, you're straining, we're going to get you into the office. You're going to fill out a questionnaire about your symptoms. We're going to scan your bladder and make sure you're not holding on to a lot of urine, because remember, here on this enlarged prostate, if you're not getting a lot of urine out there and the capacity of your bladder is pretty big, you may have a little bit of urine left over, right? You may think that you're empty, or maybe you don't feel like you're empty. So we scan your bladder in the office and we're checking for that. And if you're holding on to a lot of urine, it gives us another piece of the puzzle. There's maybe significant retention there. And there's diagnostic things that we do. We go in and we look at your bladder with a camera. It's called a cystoscopy. And then we look at the size of your prostate with an ultrasound. So again, this is the pathway of non-elevated PSA and urinary symptoms that we want to go through. And there are medications that we can do for enlarged prostate. Oftentimes they come with different side effects and things like that. So we try to not encourage medications as much as possible, but they are options. And then there are minimally invasive procedures that our doctors do as well. So lots of different treatment options when we take that pathway, and just all part of the process of screening and things like that. So, if someone or you yourself have symptoms related to that, it's important to just check in with your provider, whoever that might be, so that you can get screened potentially if it's appropriate for prostate cancer. Or BPH, looking to see if that's also a potential problem as well. So that's prostate health in a nutshell. Lots of information to absorb there, but very, very important to be screened. So testicular cancer and self exams. This one is a cancer that is typically in men at the age between the ages of like 15 and 35, often diagnosed probably early 18, 19, 20s, oftentimes is where we see that. And interestingly enough, it has another spike after the age of 60 in a small amount of men. So it's never too late to be checking your testicles and making sure you're looking for any changes. So what does that mean? How do I do that? Well, just like women have to do self exams on their breasts monthly, or at least we're encouraged to do that. Men, you have a part of your body that needs to be checked monthly as well. And I say monthly because we don't want you to be so focused on the testicles that you're checking it every day, because oftentimes you're not aware of the changes. There needs to be more time sort of lapsed in between, and you also don't want to be hyper focused on things that may not be there as well. So monthly checks are super important. Testicular cancer is highly treatable when caught early, and so doing these self exams are definitely part of the of getting you to the office and getting a provider to then assess, and ultimately maybe the ultrasound, which is what we would do. We would send an order for an ultrasound to confirm any mass or anything like that that might be in the testicle. So testicular self-exam. So step one, you're gonna cup the testicles sort of with both hands, but you're going to use one hand between your the thumb and the fingers, and just slightly apply pressure around that testicle, and you're just kind of trying to familiarize yourself with the anatomy and your own anatomy, and you're looking for any changes, any lumps, any size irregularities, things that maybe are painful or maybe not painful. um, you, uh, Typically testicular cancer is not a painful thing to find. Usually it's hard testicle. So your testicle is like super hard, and firm, and but there's no pain associated with it. Now that doesn't mean that if you have pain you don't have testicular cancer. Sometimes people will have an infection of the testicle called orchitis, that could be often secondary to that could be going on there and masking another lump or something like that. So it's always good to just, if you feel anything different, you have swelling of the testicle, You have pain of the testicle, different, texture of the testicle, things like that. It's important to reach out to a provider so that we can get you checked out and kind of go through that process. Oftentimes, again, testicular cancer will be a mass will be seen on ultrasound is what we usually start off with, and then that kind of transitions into potentially other imaging, blood work, looking for different types of abnormalities in the blood work and things like that. So that's testicular cancer, sort of quick version of it. But the takeaway here, I would say, is definitely to do those monthly exams. For anybody who's on the call that's a female, encouraging your partners or your family members, whoever that might be, to do these testicular exams. Again, it is mostly in a younger population of patients, but that does, again, it has a spike over the age of 60. So it's always important to kind of just be aware of any changes that might be happening in the testicles. So, testosterone and hormone optimization. So, I think testosterone historically has had a bad reputation. There's kind of a little bit of a stigma on it, kind of associated more with like, the gym bros or whatever, what have you, in regards to beefing up and that kind of thing. But testosterone is an important hormone, not just for men, but for women too. But mostly for men because you guys need it in a higher level, and it can be an important part of how you function. Now, there's some nuances nowadays where, you know, optimization of testosterone does not have to be exogenous testosterone, meaning it doesn't have to be an injection. It doesn't have to be cream. We now have medications like oral medications like enclomiphene or Clomid that you can use, and these work differently in the body. So instead of replacing your body with testosterone like you would with an injection or cream or pellets, you're now taking a medication that's going to tell your brain to tell your testicles to push out more of your endogenous production, so what you're already making on your own. So no more feeling like you have to be doing injections or losing testicular function or losing fertility, possibility of fertility and those kind of things. There's other options out there. So I like to say that because not a lot of people think that. And they stray away from even checking their testosterone because of that. Now, testosterone's not for the optimization of testosterone is not for everyone. We do want to make sure that if you are having symptoms, which oftentimes include fatigue, low libido, sleep issues, weight gain, especially like in the belly area, that you are getting like baseline labs. So we want to rule out other major ailments that might be going on. We want to make sure it's not associated with, thyroid or anemia or, high cholesterol levels, blood pressure, diabetes, things of that nature. We want to do baseline labs to rule those type of things out, and then also screen you for things like sleep apnea, because that's oftentimes missed. And studies show that people who have undiagnosed or untreated sleep apnea have lower testosterone levels. So, and a big sign of sleep apnea, of course, can be snoring, but it's also just daytime sleepiness and ED and things like swelling of the legs or dry mouth. So there are other factors that could point to sleep apnea that you're just not aware of, but that you need to be screened for. So super important to do. And again, optimizing your testosterone, if it's low, can potentially be something that's helpful. It doesn't mean that it's going to be the end all be all, but optimizing testosterone oftentimes brings energy back to guys. They have better libido if there is some erectile dysfunction issues there. Hand in hand with ED treatments, optimizing testosterone is always a good sort of adjunct treatment to do as well. So testosterone is an important hormone, and it shouldn't be stigmatized or looked at as something bad if you want to optimize your testosterone. We're not looking to, get you to, super high levels or anything, but we're just trying to get you back into a normal level. So normal is between 300 and 1100, but that's based on age. So you often, as a man, you have a testosterone level that's in the 1,000 level or 900s when you're younger. And then as you age, that testosterone level gets lower with time. So historically, 200 or 300 was a low testosterone level, was an average testosterone level for a man in his 70s. However, nowadays, there's information out there, as well as anecdotally, I can say that I've seen it, where men are younger and having lower testosterone levels. And there's a lot of theories that, are circled around environmental factors, microplastics, and things like that. But the reality is, our men are younger and they have low testosterone levels, and they don't have to necessarily go out there and get testosterone injections. There's ways to preserve your testicular function, and that's through things like, again, enclomiphene or Clomid that you can take. So certainly some options there. We don't want to feel like testosterone is something that's bad to look at or get tested or anything like that. It's perfectly normal and should probably be routine nowadays, just to kind of add it in, especially at a certain age. So as you see here in this photo, it just kind of tells you, how is testosterone made. There's a gland in your brain called the pituitary gland that tells your testes to release LH and FSH, which are factors that help make testosterone and sperm. And so this enclomiphene or Clomid oral medication that you would take tells your body to make more of those LH and FSH, subsequently making more testosterone. So it's not inhibiting your natural production. It's just telling your body, hey, make more, make more, make more. And as a result, you optimize your testosterone. So, yeah, as you see here, it can affect sexual health, physical health, bone health. And it's just important part of the puzzle if you have guys out there that are symptomatic. So keep testosterone in mind, even if you're just monitoring your testosterone, and which means you just want to see what your testosterone level is, and then kind of trend your testosterone over time. That's not a bad idea either. I think it's super important to just kind of be aware and have that as part of the equation. So sexual health is a very important part of a lot of people's lives, right? ED or erectile dysfunction is very common and very treatable. There's a litany of things that could potentially be causing erectile dysfunction, from vascular to hormonal to psychological. And when we treat erectile dysfunction, we are looking at labs, and that's why that's important. We're looking at labs to make sure that there's no cardiovascular risk, right? Making sure there's no high cholesterol levels. Or we're checking blood pressures, making sure high blood pressure is not an issue. Hormone levels, we're looking at diabetes as a potential factor. And then there's other things like lifestyle, cigarette smoking, medications, alcohol. And yes, there are some medications that can cause erectile dysfunction. And some of those medications are blood pressure medications. So, if you have an onset of, erectile dysfunction or an inability to maintain erections or something like that after starting new medications, ask your provider, advocate for yourself and say, hey, this started after I started this medication, and I think it might be causing it. There's no problem with saying that, and there are alternative blood pressure medications that can be used in certain people. Obviously, not everybody is the same, but potential to ask. Also, antidepressant medications can also be something that can cause or worsen erectile dysfunction. And so super important to just kind of be aware of that in terms of, when you're assessing for different causes. Now, in terms of treatment of erectile dysfunction, you can start as conservatively as lifestyle changes, right? Making sure you maybe moderate, um, take into moderation certain alcohol intake, maybe stop smoking if you can, exercise, right? Even with testosterone optimization, I always say, for optimizing your testosterone, whatever treatment we're doing is just a tool in your toolbox, which means I still need you to, once it gets you the energy that you need, I still need you to exercise. I still need you to eat really well. All of those things that we kind of already know are super important. So lifestyle modifications are not just a want thing that we often hear. It's something that's real, and there's lots of studies and things that kind of point towards that as well. There are oral medications for erectile dysfunction, things like Cialis and Viagra, sort of name brand medications that we all know about. There's injectables for erectile dysfunction, like Trimix, that's injected straight into what we call the corpus cavernosum of the penis. So this is a self injection that you do at home. Can sound a little intimidating, but Trimix tends to be give really good results as a overall erectile dysfunction medication treatment, especially if oral medications have not helped or stopped working or something like that. So um, it's always good to get to the underlying cause of erectile dysfunction, right? Whether that's from like a psychological standpoint, or physiological or vascular standpoint. Getting to the root of the cause is always going to be the best thing to do. But oftentimes, you've gone through the rigmarole, and you're still left with this issue, and that's okay too, right? And so that's why we have all of these different options in order to help and assist you with that. So again, just part of the conversations, when you have with your provider, we're trying to elicit some information from you. We want you to ask questions, things like that, and hopefully, get to uh, a resolution for the erectile dysfunction. So tons of treatment options and things there, just depending on kind of where you are in your journey. But don't feel afraid to speak up. We are here to assist you with any of those needs that you have there as well. So now, metabolic and lifestyle wellness. So I loved this picture slide for the simple fact that it just kind of summarizes everything that needs to be said about men's health. That's super important. It kind of encompasses all the different things. Like I've said over and over throughout the webinar, sleep is important, diet and nutrition is important, exercise, stress is another one. I think it's important to note, and we'll talk about it in the slide about mental health, that oftentimes, depending on your situation, men oftentimes have a burden of stress that for, caring for the family, or, not just his immediate family, maybe, other family members, elderly or whatnot. Sometimes it's, being in school, and the stress of getting to certain areas of life and careers and children and different stressors of that nature. So stress can be not just a woman's thing, but men, you guys carry your stress in different ways as well, and it's important to recognize that. And so here on this picture, you see mental wellness. Inactive men are 60% more likely to suffer from depression than those who are active. So it's as easy as just being active sometimes, whether that's walking, or joining a class, or doing some sort of activity. It's important to stay active to reduce any sort of potential for depression that might be lingering. Also, nutrition. So here the slide says getting your 5 to 7 servings of fruit and veggies can be as simple as a glass of orange juice, one potato, one big carrot, half an avocado, and a pear. So right there, just making sure, and then water intake as well, just being hydrated, especially from, from a urology standpoint, hydration is super important for the kidneys, for your bladder, and just part of that nutrition factor as well. Only 30% of a man's overall health is determined by his genetics. So 70% is controllable through lifestyle. So we can't always blame the genes, even though the genes do play a big role as, a partial role in there as well. We want to encourage, self made things and getting active. Sleep is another one. 7 to 8 hours of sleep is important, and about 60% less risk of fatal heart attack for those who sleep 5 hours or less. So not only is sleep important, but quality of sleep is important. And so, going back to potential sleep apnea, if sleep apnea is preventing you from getting those 7 to 8 hours of sleep and good quality sleep because you're gasping for air, you're choking, or different things like that, then we need to get you treated because you're losing oxygen to your brain and so on and so forth. So, it's important to get good sleep. It's good for cardiovascular health, but also hormonal health, as we talked about before. And then there's a slide here on drinking. So those who consume 4 to 10 drinks a week at most have a lower risk of developing type 2 diabetes compared to those who might drink um, 10 or more in a week. It doubles your risk of type 2 diabetes. So, sort of different statistics here for mental health, for diabetes, for cardiovascular. But overall, staying healthy, having lower weight because obesity can lower your testosterone as well. And just making little small changes overall in your daily life can certainly be consequential in terms of like overall health. So, making changes, whatever those small changes might be, are super important. So, if you're on the call and you're a female, again, just encouraging those males in your life to do what they can, or even getting out there, walking with them, changing different habits along with them and stuff like that if they are at risk. Super important. I know sometimes the men in our lives can be stubborn and it can be hard to encourage that. But I think that oftentimes if we approach it in the right way, it can be super beneficial and maybe provide them with some information like what we've talked about tonight to help encourage some of those changes. So, sort of last piece, but also very important piece is mental health. So, as I mentioned earlier, mental health, it's very important. For men, there's a big stigma of depression and things of that nature. And uh, this little photo here is great because it shows how it's okay to cry. It's okay to be vulnerable, to go to therapy, to ask for help. And I think that sometimes from either culturally or religiously or, different factors can play into why these things may be stigmatized. But, talking to just all the men out there in general, crying is actually is a physiological response to releasing stress. Like crying is good for you. And you don't have to cry in front of people, but even if it's crying in the shower or crying in the car on your way home or whatever that is, it's okay to just cry sometimes. I'm sure a lot of people are like, oh my God, what is she talking about? But just having these feelings, it's, and another one here, it's okay to feel, it's okay to be weak, to have bad days. You don't always have to be strong and carry that burden, whatever that might be. It's just it's okay. In general, it's okay. And with the statistics being higher, suicide rates and things like that in men, we're seeing it so much too here in anybody who's a football fan in the football arena, these young guys committing suicide and things like that. It's just awful. And so I think that encouraging conversation, talking about it, it's part of the process, and that mind body connection is real. So like, even if it is, you taking a walk in the evenings or early in the morning, or joining a gym, or joining, other classes and things that can kind of keep you active, that is a clear connection with how your mind operates as well, so kind of keeps you out of that funk and things like that. So I highly encourage we're out here in support of you men, all of you men, and we want you to know that it's okay, and that we're here for you. And even as a provider, if there are challenges that come about, a lot of these other things that I just talked about, your prostate health, your testicular health, your hormonal health, your sexual health, those are things that can mess with your mental health. And if you come in, we can certainly talk to you about those things, and see how we can help you, sort of encourage better outcomes, and talk to you about it. So it starts with a conversation always. So taking the first step, scheduling your annual health men's visit. So if you have a primary care provider, make sure you're getting that annual physical every year. If you don't have a primary care provider, get one, please. Just once a year, that's all we're asking, where you can get labs done, you can kind of ask questions, you can get baseline, you can see where you are, right? Because you don't know until you know. If there are things that come up, you're doing your monthly testicular exam and you see things, that you feel things, and you're not sure, that's another time to reach out, right? If you hear that somebody, dad's brother got prostate cancer, or somebody got diagnosed with prostate cancer that's of your family member, that's another reason to reach out, and maybe, let's get you screened. So screenings, labs, all part of those steps to take. And then lastly, just really talking about it. Let's talk about it. Let's have the conversations, whatever that means for you. Again, your annual physical exams are a really great time to do that. If you don't have a good primary care provider, we at Austin Urology Institute can recommend one for you. You can come see us if you're just needing to get screened and have that exam. We're here for that kind of stuff. So we certainly encourage you to do so. So thank you all for attending. I really appreciate everybody that's been on the call. There are some minutes left of the webinar. So if anybody has any questions, I'm happy to take any questions, either on here or offline. You can also visit our website if you are not a current patient, to schedule an appointment with us. Or if you are a current patient, you can always send us a message, get set up if you feel like today kind of rang some bells for you, and maybe it's time to get checked out. So yeah, thank you so much again for attending, and it's been a pleasure. Again, happy International Men's Day, and we are rooting for all you men out there. And hopefully, this inspired you to take charge of your health, and really go forth with doing what you can to be great and have a great life.